you're currently using traditional health insurance, you probably know that open enrollment is currently happening here in the United States. Open enrollment is basically when you have the chance to jump ship on your current insurance plan and pick up a new one. It's a time when all of the insurance options are on the table and you can choose something new for yourself. Well, you have probably noticed that insurance has become a lot more expensive. Not only that, but just general healthcare costs here in the US have dramatically increased as well. And so the cost for healthcare is very, very pricey. And at some points, I know that you might be thinking, what's the point? I'm a generally healthy young adult and I barely go to the doctor as it is. Why do I need health insurance? Should I just get rid of it? Are there any alternatives to what is customary? Well, in this video, I am going to share with you 2 money-saving health insurance alternatives that I believe you need to look into to see if they may be a good fit for your health needs. Hey there, I'm Katie Jones. I'm a faith-based money coach and I help young professionals to learn excellent money management skills that are rooted in the gospel. If that's something that you find interesting, be sure to hit subscribe and like this video if you do find it helpful in thinking a little bit outside the box with your healthcare journey. Before we even talk about any health insurance alternatives, I want to make it very clear too that one of the best ways that you can actually help save yourself a ton of money on health related expenses is to stay healthy, to take care of your body, have a good diet, exercise, get good sleep, drink lots of water, protect yourself from the sun. These are all very good things that if you do them now as a young adult, that they will help save you money in the long run. So it will help reduce your risks for different cancers. So for example, wearing sunscreen and staying in the shade more often than just having the sun beat down on you constantly is one way that you can reduce your risk for skin cancer. And even eating a balanced diet, eating lots of fruits and veggies, getting good sleep and exercising will help to reduce your risk for heart attacks. So these are really great ways that you can prevent needing any kind of health related expense, and that will ultimately save you money and help you live a healthier, longer, more energetic life. So I definitely recommend first reevaluating your current health status and working on the areas that need adjusting now versus once you have some kind of health problem down the road. But staying healthy doesn't always prevent you from everything. For example, you could be a very healthy athlete and yet have some kind of incident where you break a leg or tear your ACL. That was something that I did when I was skiing. And so having health insurance is still very important, even if you are a healthy person, because the purpose of health insurance and all insurance in general is to reduce your risk of financial losses. It moves the burden off of your shoulders and puts them on somebody else's. And so insurance steps in to help cover your costs when you do have some kind of catastrophic event. So even if we try to stay as healthy as we can, we still run into incidents where we might need some kind of insurance to help pick up the costs for those incidents. However, even though it is important to have some kind of coverage for those catastrophic events, it doesn't mean that all health insurance is created equal. And as I mentioned, health insurance is becoming very, very expensive. And so it really does get us begging that question of, is there an alternative and is there something better out there that we should be looking into? And when I'm being really honest, the traditional health insurance and healthcare system here in America isn't set up very well and really doesn't seem like it has us as the patient's best interest in mind. And so when I personally was looking for alternatives for my health insurance, mostly originally just as an idea of saving money, at the same time, I started thinking, is there something better and is there a different way that I could be doing this? Is there something outside of the traditional health insurance system that I should be looking at? And so that brings me to the two main health insurance alternatives that I want to share with you today that I know will help you save money, because it's saving me money right now. But I really think that they help you to be more engaged with your health in order to stay healthy, in order to reduce your health costs in the long run. And so these are my favorite health insurance alternatives. So health insurance alternative number one are cost sharing programs. A health cost sharing program is kind of exactly what it sounds like. It's where a group of people come together and share the burdens of their health expenses together. They work very similarly to insurance. So with a health cost sharing program, everybody's pooling their money together in order to cover the costs of each other's medical burdens. So a health cost sharing program is considered to be a nonprofit in which the members of this nonprofit will donate a specified amount every month that will get pooled together in order to be used for each other's medical expenses. So the members are essentially sharing the costs of their medical expenses. My husband and I have now been a part of a health cost sharing ministry for the last 2 years. We have really enjoyed being a part of a health cost sharing ministry. We have not only saved a lot of money, but we really enjoy the process a lot more than just regular health insurance. The health cost sharing ministry that we are a part of is Christian Healthcare Ministries. If you'd like to learn more about CHM and what they're all about, as well as what it looks like to be a member of a cost sharing program, definitely go check out this video that will help you get an idea of what it looks like, as well as share a little bit more about why we love CHM specifically. So essentially, as members of a cost sharing program, we will pay a monthly membership fee. It's also considered like a donation to the nonprofit, to the ministry. And then whenever we have any kind of catastrophic medical event, we fill out some forms, explain our situation, submit those to the ministry, and then if that event qualifies and gets approved to be shared within the ministry, CHM actually will then send us a check to either go and pay for our medical bills, or if we've already paid for them, they go to just reimburse us. I have had a couple of medical incidents already while being a member of CHM, and it was a really easy process to submit the forms online and then get that money back. And I legit got checks in the mail with the amounts and what they were going towards, like what bills they were paying after I've submitted them. So even though a health cost sharing program does work pretty similarly to health insurance, one of the really big differences between the two is how you actually communicate with your program and with your doctor or a hospital. So your health cost sharing program, most likely, in most cases, for most of the programs out there, they will not communicate directly to your doctor or hospital or medical provider. That is on your shoulders. And so using a health cost sharing program, even though they are cheaper, there is a little bit more work on your part. And so that's why health cost sharing programs aren't for everyone. I actually have really enjoyed being more involved in my billing process and understanding more about medical bills. One of the things that I have been shocked about is the fact that I will receive, so for example, for my knee surgery, I received a quote from the hospital for what the surgery was going to cost. Originally, the cost was something like $80,000. Because I was considered a self-pay patient, under health cost sharing programs, you're considered to be a self-pay patient since you aren't under traditional insurance. So since I was considered self-pay, the hospital gave me like a 60% discount on the surgery. And this is because of the way that insurance works with hospitals. Insurance pays these like inflated rates for medical bills. And so that's how it all works and why it's so expensive for us as patients to be using insurance versus just being self-pay or something else. So for most of my doctor's appointments and medical visits and all these things, when I let them know, hey, I'm a self-pay patient, do you offer any self-pay discounts? Oh yeah, Katie, we do. In fact, it's 80% off or something ridiculous. Seriously, the health insurance and health care system is pretty ridiculous. And I've actually really enjoyed being a part of a health cost sharing program because I've actually learned more about that and been more involved in my own health care process. So I've actually really enjoyed that. But it's definitely not for everyone because it does require a little bit more work. The best way that I have found to keep track of everything with being a part of a health cost sharing program is to keep a spreadsheet of all of my medical bills, all the discounts I receive, how much I've paid, and then how much I've received back from the program, from CHM, the ministry that we're a part of. If you are going to join a health cost sharing program, or if you already are a part of one, I do have a free spreadsheet that you can use. It's the same exact one that I use for our medical bills. You can grab that in the show notes below. If you're interested in checking out a health cost sharing program for yourself, feel free to check out CHM. It's the one that we highly recommend and the one that we've been a part of now for 2 years. However, here's a list of a few more that I found online. Some of the other popular ones being Medishare, which is also another Christian, faith-based program. Samaritan is another Christian faith-based program. There's a few out there that aren't faith-based, so if you're looking for a non-Christian ministry organization, for your health cost sharing program, definitely check out any number of these as well. All right, so health insurance alternative number 2 are primary care memberships. One of the expenses that is typically not shared within a health cost sharing program are primary care physicians. When you have to go to the doctor for a sick visit, like if you have the flu and need antibiotics, those things typically aren't covered within a health cost sharing program, mostly because those expenses are relatively low. And health cost sharing programs generally, not all of them, but generally most of them will cover just catastrophic events. So if you're looking for a good alternative for some kind of primary care coverage, I highly recommend checking out a primary care membership. Another name for a primary care membership is direct primary care, or DPC. And it basically means that instead of going through insurance, the primary care is just going directly to you. So you don't have to work with insurance. They cut it out, they cut out that middleman, and you work primarily with your physician, which means that your costs are lower. Now, after switching to a health cost sharing program, we didn't have any kind of coverage or anything like that for primary care. That was something that we just chose to do out of pocket, and you can definitely do this. We did that for a year, and we really only went to the doctor when we were sick. We did, however, choose not to go for just like annual checkups because we said, well, if we're paying for this out of pocket, maybe we don't want to do that because we feel pretty healthy, and what's the point? Well, again, I would challenge you, if that's your thinking, because that was my thinking last year, stay on top of going to the doctor on an annual basis at least, because it's like going to the dentist or getting your eyes checked. You want to make sure that you're in good physical condition. They'll do blood draws, make sure that like cholesterol levels are good, different things like that, and make sure that you still are on a good trajectory for your health. So I do definitely recommend doing annual checkups if you've been skipping out on them. Another reason that you might still want some kind of coverage for your primary care physician is if you have a family with kids who are getting sick all the time, or even if you are someone who happens to get sick all the time and you need antibiotics or need to go in to get rashes looked at or something. If you feel like you're getting those kind of checkups often, a primary care membership is probably going to be a really good option for you. So primary care membership is exactly what it sounds like. It's a monthly membership. Typically, you pay a monthly membership fee to be a part of it, and you get all of your primary care physician services included within that membership. So this could include things like sick visits, annual physicals, pediatrician care, blood tests, or other lab work, and oftentimes they offer savings on prescriptions. One of the other really great things about working directly with a primary care physician is I have found that they actually have your best interest at mind. Because when doctors are usually working with the insurance system, they typically try to get as much money from insurance as they can. But when you're paying a flat membership fee, that doctor really wants to take care of you. Typically, I can't say that for all doctors, but I have found that primary care physicians who offer a direct and independent option for their patients tend to want to help more and actually take care of their patients and offer more personalized services, like being on call for them when they have questions, maybe that come up in the middle of the night, whether that's through a chat or whether you can call them physically. They tend to be more involved in your healthcare journey. So that is one thing that I have personally found to be true with the health cost sharing membership that I eventually did join. So the primary care membership that I actually joined was Forward. You may or may not have seen advertisements for them here on YouTube or other places like on Instagram, which is actually where I originally found them. I have really enjoyed working with Forward as a patient or a member now because of their big focus on preventative care. I really love trying to take care of my body and trying to stay in the best physical shape that I can in order to stay healthy long term and to reduce my healthcare costs like I've been talking about. And Forward has been a really great partner in that. I have seen my Forward doctor more times in the last 4 months than I saw a doctor in the last 10 years. And it's not because I'm really unhealthy or anything along those lines, and it's not like I found anything crazy. It's because we're actually working on a plan to just get me really healthy and just be in really good shape and to achieve my health goals, things like weight goals and nutrition goals. And I really, really enjoy that. If you want to know more about Forward and what it's like to be a Forward member, let me know. It's not something I've created a video on just yet, but I'd be happy to create one if it's something that you're interested in learning more about. Now, if Forward doesn't have an office near you and you're still interested in finding a direct primary care physician, I have a link to a map in the show notes below that will help you find a DPC provider that is near to you. This map will also help you to see what kind of services they provide and see what their costs are, all those kinds of things. So I highly recommend checking it out, especially if you are looking for some kind of primary care physician outside of insurance. All right, there you have it. Those are my two very favorite health insurance alternatives, and I hope that you found this video helpful. Whether or not you're planning on switching today or anytime soon, at least I hope that I started to get you to think a little bit outside of the box. The traditional system has been around for a long time, and sometimes we just need to start thinking about things a little differently. Why do we do healthcare the way that we do? And is there a better option out there that can not only save us money, but help us stay more involved in our health, to be more proactive, to be better covered, and to really just have more caring people involved in our health experiences? If you have any questions about what it's like to be a part of a cost-sharing program or a part of a primary care membership, please let me know in the comments. I love answering your questions, and I do want to help you make the best informed decision to help you save money. And in this case, I really want you to make the best decision for you and your health journey. Let me know what your questions are in the comments below. If you did find this video helpful, please be sure to give it a like. That always helps me out, knowing that I'm creating content that you find helpful, and I'll create more like it in the future. If you're not already subscribed to my channel, I create videos on faith-based money management, so be sure to subscribe if that's something that you are interested in. And with that, I will see you next time.